Hi, my name is Jessica Smith, student ID E3107955. This is VTHT2325-31421, and this is the fall 2018 semester. So we're going to go and halter a horse. So what you're going to do is you're going to take the bigger part and go underneath. Put these behind his ear, and then take the clip and attach it like that. And then for your lead rope, you're going to take and connect right down here where the buckle is. And then so we're going to go right over here and we're going to tie him up to just the door right here. So what you're going to do is take your rope for your lead. Just tighten your knot, and what this will do is it's just like a little knot to where he would you can tie them up to any kind of door or entrance in the barn to keep them onto the door. To quick release, you're just going to pull on the end and it should untie. We're going to apply a twitch, so what you're going to do is take your hand and put your fingers through it, and then you're going to grab onto the horse's lip, and then what you're going to do is take your twitch and start twisting, and what that'll do is it creates a tight hinge on the lip, and that's that's an acupuncture point, so the horse will be a lot more willing to sit still for procedures and different things that you may be doing to the horse. So first we're going to do a tail wrap. So what you want to do is take your brown gauze and you're going to grab the base of the tail, and then what you're going to do is get the gauze up and around the tail, and what you're going to do is do a couple wrappings on the top of the tail to kind of secure it there. And at this point you're going to take a little bit of the hair and intertwine it in the tail wrap just so that it doesn't slide down. And then you're going to go, so for a female you would go to the point of the vulva, but this is a male, so you, depending on what you have to get the tail out of the way for, you don't have to go too far down, but so this is probably a good amount. So what you're going to do now is take the wrap and do a little tie at the bottom. Just by feeding it underneath. And then you're going to take the brown gauze over here and then go around his neck. And then when you're over here, you're going to do an easy tie. Or easy release tie. So when you're tying your easy release knot, what you're going to do is take the ends and make sure your tail is out of the way still. You're going to take your loop up here twist around to where the loop goes in, and then what you're going to be able to do with this is pull on the end, and then the tail wrap will release and you can just take it off easily. Alright, we're going to do a bandage. So say the horse, so this is the cannon bones, so we're going to pretend that there was maybe a laceration on the cannon bone. So we're going to use the abdominal pad as the cushion. So what you're going to do is you're going to position it over the wound, and we're going to use the back part of the pad to cushion all the ligaments. So you're going to start in the front and make your way around the back. And try and leave a little layer on the top. You don't want to make this too tight, but you want to make it tight enough to where it'll do its job. So, and then once you are finished wrapping that around, you're just going to tear it, and that should be good. So then when you go to take this off, what you want to do, so remember our laceration was going to be right here, so you want to choose somewhere that isn't on top of the wound to cut it off. So take your bandage scissors and then you just work your way down, cutting it off. That way you're not making it uncomfortable for the pet and potentially making the laceration worse. So we're going to do a leg wrap. So first you're going to take this and we're going to take this and so you're going to start in the front and then roll towards the back of the horse. Next you're going to, alright, so you're going to take the next layer and start from where the other one stopped. You're going to take it and tighten it in the front as you're going around. Once you get to the Velcro, you're going to take it and just kind of put it on there. What you're going to do is take your fingers and you want to make sure that it's not too tight, and so about 2 fingers, both the front and the back can fit. So that should be good. You don't want a ton of room because then it's not going to do its job. Okay, so we're going to get the x-ray machine ready. So first we're going to take our plate out and just set it down. And then we have our computer.
I think they're sitting on top of the old x-ray machine in the office.
So then,
I mean, that would be the only other place that they're being
so
there.
for the actual x-ray machine, so if you look over here, so the power button is going to be right here, so you just turn it on. And then with the button, so if you do the halfway point, that'll get the x-ray machine ready for the x-ray. And then in the meantime, you're just gonna let it warm up, and then we'll get the horse ready and put the plate in front of the leg for the x-ray. Alright, so we're gonna x-ray the distal front limb of the horse. So what you're gonna do is you're gonna take your pointer.
Keep coming closer. That's good.
And then once you get the point, you're gonna hit it, and then alright, now we're gonna take a lateral picture of the fetlock. So after you take the x-ray, it'll show up on the computer. Alright, so we're going to do an enteral dosing syringe full of dewormer. So what you want to do is take your syringe and put it right in the lip, and what the horse will usually do is open up their mouth, and you want to push and have it go in between the canine and the molar, and kind of get it up on top of the tongue, and then they'll swallow it. Alright, so we're going to do a jugular blood draw on a horse. So this is the jugular furrow, so you're going to take your thumb and press down, and if you can see, his jugular vein is popping out. So you're going to take your needle and then take your vacutainer and then once it's full, you're going to just release the tube out and then take your needle out. Alright, so we are going to vaccinate this horse. So you're going to use the triangle. So this is the cervical vertebrae, the shoulder joint, and then the knuckle ligament. So you're going to go right at the base of the triangle, so like right there would be fine. So you're going to take your vaccine and kind of go like a dart, and then pull back, making sure that you don't have any blood or anything, and then just inject. Alright, so we're going to do an IV injection. So you're going to hold off, and then what you're going to do is take it. And then you're going to inject. And then what you want to do is kind of keep on making sure that you're in the vein by withdrawing every once in a while. Alright, so we're going to take a temperature. So what you want to do is let the horse know you're there. You're going to take the tail and kind of move it to the side a little bit, and then just gently insert it in. So 98.9, which is normal. Alright, so we're going to take the heart rate and the pulse, or the respiration. So you're going to take your stethoscope and then count till 15 seconds, and then multiply by 4. So I got 9, which is normal, in 15 seconds, so that's totally normal. It'll be about 36, I believe. Alright, so for the respirations, so the general lung field is right about here. You can look at the abdomen to see it moving for respirations, but I'm just going to use the stethoscope so I can know for sure if it is a breath or not. So I got a total of 3, which is 12 in a minute, so that's totally normal. Alright, so we're just going to listen to the heart and the lungs just to check for any abnormal sounds, any murmurs that you might hear. So I'm going to do the heart first. So same place that you were at for the heart rate. I didn't hear any abnormal sounds in his heart, so I'm going to move on to the lungs. So I didn't hear anything like wheezing or anything like fluid or anything. So what I basically did, I was listening with the stethoscope, but I was looking at the abdomen to look at the horse breathe in and out to make sure that I was listening for the inhale and the exhale. So looks like this little baby's got good heart and lungs. Alright, so I just got done listening to the right side of the horse, and just like I did on the left, and same thing, the lungs and the heart sound good. Alright, so we're going to do the Californian mastitis test. So you have your tray, and so what you're going to do is take each quarter and get a good amount of milk into each section, and then afterwards we'll add the solution to see if any of them gel up. So what you're going to do is you're going to take it,
Yeah, go next one.
once you get a good amount of milk, so you're going to take your sample and kind of tip it, try and get them to be an equal amount, and then you're going to add it to each one. And kind of mix it around, and what you're looking for is the gel, and that quarter will tell you which one may or may not have mastitis in it. So when
you pour it, the one, if it's gel, that one will have mastitis in it. So as you can see, that one was all jelly and ran down, and these are all watery. So this quarter would have had the mastitis in it. Alright, so this is a hydraulic chute. So as you can see, the paddle has got, it's pressing on the neck and the body to keep the paddle straight and still. So what you're going to do to let the paddle out is push up, and this will release the neck, and then the second one will release the body. So
there he goes.
there you go. Okay, and then they'll walk out. And then the next thing you can do is open the other side for the next paddle to come in. Alright, so now I'm going to let the next cow in. So just open up the door.
I think you need to open the front a little. Open the front a little. I think you need to open the front a little. Just a little. There you go. There you go. So the head can go through. Good job. Good job.
So we're going to halter a cow. So this part's going to go around the mouth, and then this part will go over the ears. So what you're going to do is go over the mouth first. And then this part just goes over their ear. And then you just tie it to the bone to train them. Tail restraints. So what you can do is you can either take the tail to the side and kind of crank it up, and that would be a good restraint. Or the other way to do it is to take their tail and you hold it up as high as they'll actually let you do it. It just kind of gets the tail out of the way for anything you may be doing back here. As you can see, they kind of don't want to let you do it, so it's a little bit of a workout, but so that's about all for the tail restraint. Alright, so we're going to do a venipuncture on a cow. So you're going to hold off, and then you're going to take your needle and then once you have your blood, you're gonna take it and then take your tube off first and then the needle, and then you're gonna hold off just to make sure that there's not gonna get a hematoma. Alright, so we're gonna do a dosing syringe. So this is just saline. So what you want to do is you're gonna take the head and kind of hold it like this and get it, the syringe right in the groove of their mouth.
Go straight into the soft palate, get on top of his tongue, and then turn back. There we go.
Alright, and then once you get in, you just inject it. This is saline, so it's going to fall out, but for like medications, what you want is to get it back and it will go into the back of their throat, and then they will swallow it. But since this is saline, it kind of fell out. But so you wrap the head around, you lift the lip and get underneath and over the tongue and then inject. So for the balling gun, what you're going to do is put your fill in the bottom, and then what you're going to do is you're going to take the towel, and then once you have it in, you're going to push until the pill comes out. And then you just want to make sure that the pill is not in the balling gun and that the cow doesn't spit it out. And then you take it. Alright, we're going to do an IV injection into the jugular vein. So we're just going to use saline again. So what you're going to do is you're going to hold off, and then if you can see that jiggling a little bit, that tells you that that's the vein. Pull back just to show that it's blood, and then inject. And then you want to hold off just to make sure that you're not going to get a hematoma. Alright, we're going to do a sub-Q injection. Again, this is just saline. So what you want to do is pinch the neck, the skin, and kind of get a little tent. And then what you'll do is you're going to put the injection or the needle right in that little tenting area. You want to pull back just to make sure there's no blood. And then slowly inject just to make sure that the cow is getting all of your injection. So we're going to take a temperature. So you're just going to take the tail, move it inside. It's 101.2, which is normal. Alright, so we're going to do the pulse and respirations on cattle. So what you're going to do is about right here, listen to the heart, and then count for 15 seconds, and then multiply it by 4. So I got about 20, so that would be 80. So that's pretty normal. So then the lung field is going to be right there. So same thing, count for 15 seconds and then multiply by 4. So I got 5, which would be 20. So that's totally normal too. And then while I was listening, you want to listen for any kind of abnormal sounds. So I'm just going to listen a little bit more to the heart and the lung just to make sure there's no abnormal sounds like murmurs or any kind of wheezing or anything that would indicate any kind of issues. So. Don't hear any murmurs, so I'm going to go under the lungs. lungs sound really clear too. So next thing, you would just go to the other side and do the same thing for the heart and the lungs, just to make sure that there's no issues with either of them or any abnormal sounds. All right, so for the IV catheter on a horse, so this is the catheter you normally would put in. It's a 5.25 inch long one, and it's got the little butterfly to suture. And then the line you would use is this one, which it gives you 2 ports to attach bags to, and it makes it, you know, go a little bit faster. But today what I'm going to use is just a short IV, just to show you just the basic steps of putting one in. This is our saline flush that you would need, and then we have a cap. This is going to be a lidocaine numbing agent that we're going to put in the spot of the IV so that it's not as painful. And then this is a needle with some suture, just to suture in the IV once it's in, and some scissors. And then what we're going to do with the tape is we're going to braid the mane and attach the IV line. We're going to put the IV line in the braid to kind of attach it a little bit better. And then lastly, this is our scrubbing. So this is alcohol, and then this is this is betadine. So what you would do is take the alcohol and the betadine after you clip it, and then scrub so that it's, you know, as sterile as you can get it before you put the actual needle in. So we're gonna clip for the IV catheter. So you want to go kind of about right here and just do a little square. Alright, so now once you have your square, what you're going to do is take your scrub and do 3 rounds of scrub, and then you're going to do your lidocaine block. So now that we did 3 scrubbings, what you're going to do is take your lidocaine and just go sub-Q where you're going to give or put in the catheter. So what that'll do is kind of numb it so that it's not as painful, just because it's a big gauge catheter. Alright, so now we're going to do our final scrub. Same thing, the betadine and then the alcohol. Alright, and now we're ready to put our catheter in. Alright, so first you're going to take your catheter out. So what you want to do is hold off, and that'll make your jugular vein pop out.
Oh, it's going. You filled it. Hold. There you go.
And then what you do is you'll add your cap onto your port, and then take your saline, and that'll just flush it just to make sure that it's patent. So you just pull back, flush, just make sure it's patent, which it is. And then next, what you want to do is we're going to attach our
tie it in first, yep.
So next, what we're going to do is do our suture to tie it in. So we have our needle with the string already through it. So what you're gonna do is go right behind.
Just pinch the skin up like you're gonna give a shot. Yep. Just push it through. There you go. And then pull it back, and then, yep, it makes the loop. There you go. Then pull your needle out.
I can't get the loop.
Sometimes you have to pull it off it.
It's like I can't see it.
If you pull the needle back, okay, there you go.
There.
Now pull your needle out.
Stand.
Good job, Junior.
Stand your butt.
There you go.
All right, so then what you do is just make a simple knot, and what this will do is it'll secure your. All right, so we're gonna clean the stall. The two types of cleaning is picking, where you just take out the dirty parts, and the other one is stripping, where you take everything out. So we're just gonna pick. So pretty much what you do, so you're gonna take your. And then what you want to do is kind of shake so you can get some of the good bedding out. And then for the urine, so what you want to do is kind of. You want to try and save as much of the bedding as you can that's still good. So you're just going to sift over where you see the urine is at. Just to save a little bit. And then yeah, you just go throughout the whole thing and collect the different spots of urine. After you think you got all of the spots, you can add more of the shavings to it.
There you go. There you go. That's great. Yeah.
You think that's good?
Yeah.
And then once you have your new shavings down, you're all done.